saying in my introductory small discussion there, there's not much patient advocacy happening in the context of India. It did not happen in the last decade or so. It has now picked up, and there are a lot of patient groups who are doing work only to improve access for medication diagnostics, etc., to their patients and patient groups or caregivers, etc., but also trying to change policy through that dialogue. So if you see the non-communicable disease space or the rare disease space, then there is a lot of work that's already happening. There are national networks.
Nadi, earphones are not working. These earphones are not working.
Particular patients so that they are able to advocate for the cause that they strongly believe in. We have a five-pronged approach. We do something like the roundtable today or panel discussion. We do online surveys, quantitative focus group discussions, in-person interviews, then gather information about what to be able to distribute it and disseminate it to the right audience. We also have projects. So PCOS is one project, endometriosis is another project. We have another project on HPV, etc., where we work with actual patients and help them to understand how to manage. Also, knowledge gaps. If there is a deficiency in knowledge in terms of where those services are available, what kind of treatments are available in the country, what is the access to those treatments, whether there is private public health insurance, this kind of information to provide to those patient groups. So today's discussion is meant to focus on 4 or 5 areas. One is to highlight infertility as a public health problem, and we know that PCOS is rampant now, where many young girls have metabolic syndrome, so they are obese, they have diabetes, and they have infertility. And this is linked to the changing lifestyles, the environmental factors, as well as stress that is increasing amongst youth. To increase awareness and have a discussion on ethical issues amongst patients, caregivers, and public, emphasize on the current situation of infertility in India and the causes and effects that infertility have, both psychosocial and it's a huge stigma. We know that people do not discuss this outside their care. In HCPs, they will discuss, they will not discuss with their family or their even immediate family. And ensuring access to fertility treatments for all in the countries and to make it more affordable and accessible. So these are the expected outcomes. And it is my pleasure to be able to invite to the dais. Can we have the slide? Dr. Geeta Bakshi, and she is an MBS CDO from Stevens Hospital and MD of Sandy Hospital, a diploma in WHO fellowship in quality across fellowship ICT, and a senior consultant in fertility specialty across colleges. She has several awards to her credit, and she will be chairing the session today. And I'm deeply honored, ma'am, that you have accepted our invite and present here in person. So thank you for coming and for watching. Everybody comes here.
Thank you so much, Dr. Ratna, for this immense honor that you've given us. We are used to treating patients, but really working on awareness, education, and the psychosocial support that patients require. It gives me an honor to be part of this. So, dear colleagues, friends, and guests, can I have first, we have everybody on the stage first? Yes. So, can we have Dr. Rakhi Singh? Dr. Rakhi Singh is chairperson of the Endocrinology Committee of 2022 and eminent doctor very active in many organizations. Welcome, Dr. Rakhi. Second, we have Dr. Nidhi Jha, the senior consultant, Nova Southern Fertility and IVF, founder and director here in Florida Clinic. Very young, budding, very enthusiastic, and very active. Welcome, Dr. Nidhi. Then we have this very pretty, graceful, and bright Jasmine Kapoor, who is the CEO of the Bloom IVF Group, and she has many people on the path of success. So welcome, Jasmine. Tuka is there online, and I had the pleasure of interacting with her on Zoom. So I welcome Tuka because he is a person who will probably be, the right person telling us about her story. And I also welcome Dr. Ratna Devi, the director of Care Academy, who will please. All right. So this, as we said, is we are meeting under FAIR, that is a Patient Academy for Innovation and Research, which is an initiative of women with wings. This is a patient-focused organization, making people become aware, get educated, give psychosocial support, and empower the patient to tackle their problems from a position of strength. Now, today we are here to discuss infertility, and we all understand that it is rising in epidemic proportion. 15% of the reproductive age, that means every 1 in 6 couples require some kind of help to get pregnant. Having dealt with thousands of such couples myself, let me tell you, it's one of the hardest roadblocks to a couple's happiness. I remember one of the stories, when one person, I was doing an IVF surrogacy and it had failed. And he called me up in the middle of the night. The wife said, "Madam, we are about to commit suicide." She said, the younger brother, who just got married much later, has just got a son today. And we both are, we tried a cycle of surrogacy, and that also hasn't worked. And I don't think we want to live anything. It took me a lot of strength and might to keep them on the path of optimism. And of course, ultimately, we were able to give them the happiness. But then that is the kind of depression, that's the kind of frustration a couple faces. And I'm sure this is a story of many couples that we are all dealing with. Social stigma, personal trauma, long, serious journey, not necessarily culminating in success. Plus the financial drain. So I think the financial and the emotional drain together, that's what takes this infertility into a very different kind of a disease spectrum, let me say, than many others. So how do we address all these issues? Let's look at ways to prevent or overcome infertility. Well, I would say awareness on egg freezing. Women trying to balance their fertility clock with their career clock. It requires a lot of awareness that we should be putting and a lot of impetus on egg freezing. Not only Google and Microsoft giving financial support to their employee, knowing that these young girls are going to take time. So supporting them on that path. And so I think it requires a lot of impetus, and I'm sure organizations like you will be a part of this. Secondly, I think use of condoms, STDs are rampant in causing PIT and again playing with the woman's fertility. So increasing use of contraception, condoms especially, I think will also go a long way. These are some of the things that I can think of, ways to do it. I'm sure most of my colleagues will also be talking about it. In fact, I believe IVF is one of the biggest scientific achievements of today's time. Imagine making a baby under the microscope, Today, at least we are talking about it. It's not that we are just leaving it to destiny and letting people remarry or try full life. We have this beautiful modality which has a success rate of at least around 40 to 50%. So you are able to tackle 50%. And if given the, all the modalities, if you have donors, so all the three players, the egg, the sperm, and the uterus. So you have the choice of, if you are lacking in one of the, things, then you can share it. And you are able to tackle this. So I think it's also goes a very, very long way in, and thousands of couples have been helped. So now, of course, with the art regulations in place, we did not have a lot till now. Now, and this is just very, very recent, just December 21, that the government passed the act, and act became a law. And today we know we cannot just give this to every single person. Not a woman more than 50 and a man more than 55. So, one other time when you would say, see a 67 or a 70-year-old giving birth, misuse of technology, as they say. So now we cannot do that. We know now a single woman, and this is the part, this the government is giving to the women. So single woman can have an IUI, she can have an IVF, she can even have a surrogate, but not single men. So I think making of regulation does put some kind of stop on some of the things, but also put things in picture. For example, a woman can donate her egg only once in her lifetime. This is to prevent misuse from, we heard of those cases, 17, 18-year-old young girls, being coerced to donate eggs a month for months together. So by regulating, by making a national registry, things are now under control. A man cannot, previously you heard even abroad, while here, a doctor giving samples to thousands of couples living nearby. So somewhere we are looking at consanguinity, we're looking at genetics, we're looking at so many other things. So this is a field which requires a lot of, so now a man, a person can donate his sperm to only one commissioning company. So that finishes the story there. So, now sharing is there, but then to a limited extent. So with all this in mind, I think we are on this very, very beautiful journey, and I think the psychosocial support that people require and job is something that I would actively be looking at. Some of my fellow students who are standing in me are only learning counseling from me. That. So they are saying, "Sir, how you're counseling? The procedure is a very separate, but how you're counseling your patient and how you are mitigating their pain and anguish is something that we all have to understand. So empathy has to be one of the strong points on which we all have to work. So let's start the discussion, and uh, I think how do we make this technology available and accessible to all? This is something some of our government organizations we know, Safdarjung Hospital, All India Institute of Medical Sciences, Maulana Azad, PSI Hospital, government, the Army Hospital, and these are some of the organizations who have started giving, but still, let me tell you, they charge around 65,000 around. Okay, so there is some kind of cost still attached, but still, I would say making accessible to one and all. How do we bring it under the insurance schemes? Because till now, infertility is not recognized under insurance. So that will be one of the points that we'll all be deliberating on. How do we prevent, first of all, or control infertility will be another. It's rising so much in young couples. Why is it rising? Let me tell you, I just today saw a girl of 30, her AMS was 0.9, and she had one failed IVF cycle. And so this is not, it's coming from a point of strength where I'm talking that both male and female gametes are somewhere depleted. What is the reason? Is it, stress, which was there always? I think I can't say that it's just suddenly gone into stress, but something is there. Could be food, could be anything, could be pesticides, could be pollution. But there is a depletion of both sperm and egg counts. So we all have to be very, very careful with the amount of gametes that we have and work around them. So I think bringing people and telling girls that they have their best eggs between 21 to 24 years, when most of them will not get married. So So it's very important to keep your fertility clock in mind when you're deciding on your own. What are the innovations? Well, that will be another thing that we'll be talking, because finally we are looking at increasing the success rates, and what are the newer innovations which have come, which can help bring this about. And as I said, we already talked of credibility of doctors. So that's something. Finally, there's a doctor who, with the coming regulations, you will not see the mushrooming of IVF clinics anymore, because they have decided on the criteria of a clinician. They have decided on the criteria of the radiologist, of the counselor, of the place, the infrastructure. Every single thing is under the lens now. So it will not be that anybody just tries an IVF specialist. So I think people, the patients get to the right place will also be an equally important thing. And lastly, of course, we will be talking with Chuka, who is the patient and who had an assiduous journey herself, and that will be the icing on the cake. So let's start with the discussion with the people that we have with us today. I think the first speaker will be Dr. Rati Singh. She will be talking on the fertility trends in India, rising infertility among the young couples. Dr. Rati Singh.
Camera.
Everybody. At the outset, I also thank the which is doing a wonderful job for all of us, for all the patients are there. And my job has been made easy by Dr. Rita Vakshimam, which she summarized the whole lecture for me. Let's move ahead and understand. We are standing today with the National Fertility Awareness Week, which starts from 24th of April to 30th of April. And we are standing here to make everybody aware of the fertility needs and why are we requiring, whether it is the population which is booming and it is that, or it is the other way around, that there is no need of fertility treatment, or there is a requirement. First, we need to understand that. Need to understand where are we standing and have an overview of the whole of the situation. What is happening, whether it is we are overpopulated or is there any need for the fertility issues, and what are the concerns for them. Currently, the fertility rate in India in 23 is 2.1 per woman, which is around 0.93% decline from 2022. India has made history recently. Decades of government effort to control the population growth are finally showing the much needed results what the government wanted. The total fertility rate, which is the average number of children who would be born to any woman in her lifetime, has declined from 2.2 in 2015 to 2016 to around 2 in 2019 to 21. It was revealed in the 5th round of the National Family Health Survey, or NHS 5, conducted over 2 years starting from 2019. The corresponding decline among the women in the urban area was 2.7 children in 1992, 93 to 1.6 children in 19 to 21. That is a huge decline which we are seeing. And the fertility rate is around 1.6 in urban areas,
while it is around still 2.1 in the rural area, which is acceptable and which is equivalent to the replacement rate. When we move around and we want to look at the religious levels where different religions can be correct, comparing it, Muslims are still better with 2.4, whereas Hindus and the Christians are around 1.9. Sikhs and Jains are around 1.6, and Buddhists are still low, around 1.4, which is C, and the average being around 2. When we compare all the states of India, where are we? When we are comparing, Bihar is far better with 2.9, doing over exceptionally good, whereas Jammu and Kashmir is the least fertile state of around 1.3, which is C. And we are doing better with the sex ratio, what the government wanted. The sex ratio is better. The contraception is well accepted in all of the countries, which is very much up. And among the neighboring countries, when you look at, Nepal is around 1.9, and the lowest fertility rate, followed by the Bangladesh, which is Sri Lanka at 2.2, and Pakistan is 3.6. And among the larger states, the fertility rate is lowest in J&K, which I had mentioned 1.4, and among the smallest states, it is lowest in Sikkim, which is around 1.1. Kerala and Tamil Nadu are the only states where the fertility has gone up, even if marginally in 2019 to 21. The total fertility rate, when we talk about the fertility rate among men aged from 25 years to 29 years of age and married before the age of 21, went down from 20% in 2015-16 to around 17.7% in 2019-21. The prevalence what we are finding in India for the males, the retrospective analysis done of 100 years, of 10 years carried out in the rural territory care center of Central India from January 2005 to December 2014. It was found that around 35% of males had a normal semen count, whereas 62% of the males had abnormal semen analysis before. So that is a huge decline. And as it is in our private practice, when we are seeing the patient analysis, when we're sitting across the microscope, there was a time in 2000 when we split it with the microscope, we used to get a very good semen analysis count. The count used to be very wide. Around 200, it was very common to have a 200 million count. Whereas nowadays, you hardly get to see around 100 million. That is also a dream. It is around 20 million, which comes around as an average. For the males, the fertility factor for the infertility cases, approximately 40 to 50% is due to the male factor of infertility, and as many as 2% of the males exhibit suboptimal semen parameters. And in the last 70 years, 20% drop in the sperm volume and 58% decline in the semen production is testosterone levels with age is always there. Let's understand that men in their late 40s and early 50s to experience a lot of sex, experience a loss of sex drive, impotence, and depression. This is due to the natural reduction in the testosterone production. By the time the man reaches 40 years of age, this testosterone will be approximately half of what was in 20s, and at around 50 years of age, the testosterone level of the hormone would be around 1/3. At 60 years, it would be around 1/4. That is how we are seeing the decline in the male infertility also as the age increases. The semen quality, when we talk about the quality, is also getting hampered. Continuously, 20 to 80 years of age, with no evidence or the threshold levels. Genetic factors.
Starting
genetic factors may not be alone contribute as a full cause for the decline, considering the dramatic environmental and the lifestyle changes that have occurred over the past few decades. Lifestyle changes such as smoking, which are increasing many folds, alcohol consumption, which is at times considered as a social get together, you have it very often. That also
वो starting करिए
and increase in the stress because of the day-to-day life and on the road. And also is one part of it. And obesity, India is being considered as the obesity capital of the world also. These are all the factors which contribute to it. Contribute towards the decline in the semen quality and the quantity. The environmental factors like high temperature, increasing exposure to the ionizing radiation, and excessive use of cell phones all have negative impact on the male infertility. That is why we are having more of the semen quality and the quantity issues and the parameters getting declined. I'll go on more about the environmental factors. There are EDCs, that is, they are the estrogen-like anti-androgenic chemicals in the environment, which we are facing with day-to-day life. Anything and everything you touch around, the plastics, everything, or the microwavable thing, the shampoos, what they use, whatever you say, the creams, what you use, have all these things in it. That is not philanthropy, PCP, DDT, digoxin are well known examples of EDC. The first few EDCs which were reported to act as endocrine disruptors, causing the spermatogenic failures were with toxin and digoxin. These environmental factors, they can be the EDCs or they can be exposed to the lifestyle factors also. The lifestyle modifications also could be helping in correcting them. Some EDCs cannot be corrected, that we leave around. But lifestyle modifications, what we can do it, we need to do it. That is, smoking can be controlled, alcohol can be taken into account, diet, temperature, radiation from the phone calls, or the radiation from the microwave. We are very easy handling all the radiations. Earlier, we used to get up to on the tube light, just sitting and on it. Just sitting and on the TV. We're sitting and doing everything in our bed. And that is increasing obesity. We don't want to walk around. That is also increasing obesity. These are the few EDCs, which environmental factors which we need to look into. These environmental factors can affect the females also. In the females, it can cause infertility, the subfertility, or the irregular reproductive cycles, menopause, premature ovarian insufficiencies, polycystic ovarian syndrome, the endometriosis, uterine fibroids. These are all the EDCs, which environmental factors, which and the effects on the males could be the infertility, the subfertility, cryptorchidism, and the hyposphagia. These are few of the things that are enumerated as the environmental factors which can be corrected and can be helping where we can do a better job. Ethnic and racial differences in the success rates of the treatment whenever we are doing. There is the Caucasians have significantly better pregnancy rates and live birth rate despite the better embryo quality at a younger age than the Indian patients. So we are already at fault because of our genetic predisposition. So we should be more concerned, we should be more proactive in following for the pregnancy test rather than postponing the pregnancy. The reasons for the infertility in India. Infertility in India is commonly acknowledged to be the cause of by the modern lifestyle, fast urbanization, hormonal changes, particularly in the prolactin level, job pressure, stress, vehicular pollution, and deferring the parenting. In the urban cities, the deferring of the parenting is the first and the foremost thing what we are looking at. The female, she gets educated, she wants to not have a child immediately, she wants to get settled, she wants to get a good income, a balanced lifestyle, and then she will cover it. By the time she thinks about it, the ovaries have started filling up. So the ovarian reserve is decreasing. So thereafter, the infertility issue starts coming in. And sexually transmitted infections, polycystic ovarian syndrome, fibroids, and genital tuberculosis are the new concerns in the women which were less in the early days. And polycystic ovary was the biggest concern, which is rising phenomenally nowadays when compared to the yesteryears, 10, 20 years back. The unhealthy eating habits are the major cause of it. The older couples is the second leading cause. Thereafter, the stress, the food, and the others follow. There are various risk factors as it is what we've understood: ethnicity, genetics, endometriosis, chemotherapy because of cancer, increasing radiation exposure, autoimmune disorders. India is becoming the diabetic capital of the world, contributing to around 1/4 cases of the world of India. Transfusion dependent thalassemia, chronic smoking, single ovary infections. There is a need to focus. There is a need to focus on the nutrition and the lifestyle improvement. Fast track treatment, the counseling of the couples, that the right age of the marriage and the right age for having the child. Adjuvants can be taken. The infertility treatment of IUI and IVF which are available. Modify the protocols and which be time lapse, cryopreservation, oocyte rejuvenation. These are all the things which are available for us. Lifestyle modification is the most important thing. It needs to be started at the early age and not once the age is declining. And nutrition and weight management, exercise, cigarette smoking and recreational and the prescription drug use, alcohol and alcohol consumption has to be decreased. Environmental and occupational exposure has to decrease. Preventive care and the other behaviors are modifiable and may impact the ovarian reserve and the fertility for the patient. Micronutrients can be supplemented, they can be taken, like the proteins, but proteins in a regular quantity, not enough excess amount to just have a bodybuilding or anything. That will again hamper the male factors. The vitamin D and B12 are important for us because they are less nowadays. Weight management has to be done because we are the kids nowadays or the elderly couple, the reproductive age group, they are going more and more into the obese fashion. So we need to focus on the lifestyle and the eating eating lifestyles have to be followed. The platter should have all the colors in it, that is all varieties. Don't eat high carbohydrate diet, don't eat high fat diet, and fast foods need to be avoided. Let's have a word about the social stigma. In many parts of the country, infertility has long been considered as a taboo and a social stigma. People are apprehensive about openly sharing and discussing their problems. Lack of understanding about the infertility and limited sources of awareness was a challenging situation, especially in the villages and the smaller cities. Since last 1 decade, there has been markedly in the trend of infertile couples and fertility service providers throughout the India. Fertility treatments requiring extensive care and insurance coverage. Insure should include the IVF, the IUI, and an embryo transfers in the products for all the stakeholders in the fertility industry. Comprehensive care and coverage for the fertility therapy would open up a new vision. Social stigma is huge for these patients, which has to be sensitively handled because these patients start avoiding the family gatherings of around 47% and avoid meeting friends by 18% and avoid social gatherings by 13% and do not like to go out at all, or they can search for any other excuses of not doing that. And they can go to that level that the mother-in-law may tell in the rural that I'm going to make the child have a second marriage. Whereas the problem may be in the family itself. But the mother-in-law is ready to understand and make the son have a second marriage also, and again land in the same suit. The role of the practitioner in infertility clinics is largely present. And we need to understand that because these all patients are having a social stigma, and there always have to be a healthcare provider, mental health expert, which could be there present in the IVF center, the counselor post, which has been included in the ART bill, so that they provide a support for all these patients who are under stress. There also has to be a public sector role in the infertility management in India. The infertility in India, the public-private providers assisted reproductive technology, which is there in some of the centers, but those centers are very few. With the PPP mode, public-private partnership mode, the centers are there in the government hospitals, but again, they are very few, and again, it is not totally free. The patient has to shell out around 50,000 plus 60,000 plus for their basic minimum needs, because the government is not coming completely, or the insurance providers are not coming completely to take care of the patients. Healthcare insurance and fertility treatment. Fertility treatment are becoming a financial and physical risk for many people. Both commercial and the government health insurance companies currently exclude fertility procedures and the treatment from their coverage policy. In India, the cost of fertility treatment is generally high for many couples. Considering a particular fertility treatment, the cost can be deterrent, and it is necessary to move fertility treatment from out of the pocket to the insured category for all our patients. As women are not the only one responsible for the infertility for the patients, which is considered as a taboo, and still the mindset is there. And always we need to, while we are counseling any infertile couple, see to it that we counsel them as a couple, not as a woman alone. Nearly around 10% of the women undergoing infertility IVF have a poor ovarian response. The overall incidence is estimated to be around 12 to 24% of infertile women, 1% of overall population, which can be encountered earlier in India. Poor ovarian reserve is defined as a reduced follicular response resulting in a low number of retrieved oocytes, despite the high doses of gonadotropin you are giving in the infertility management. At least 27 definitions which are available, which describe in literature no more than sets of investigator to use as a single definition. What we need to give, that poor ovarian reserve does exist, and it is there. The medical survey, which was conducted in various cities in India, revealed a shockingly truth that the rate of infertility is increasing in urban India, as this is most common among the IT professionals. According to the survey, about 15 out of 100 couples from the sector faces infertility, and 40 such cases are related to the male infertility. And the females, if they are deferring the age for the pregnancy, if they don't want the pregnancy to occur, they can opt for early inside easy preservation of the eggs. They can do it in the early age. So by the time you are ready for the pregnancy to occur, when you are ready to have a pregnancy, you don't have a poor ovarian reserve, and you don't have the problems of conceptions. And the oocytes, the eggs which you have frozen earlier, you can take those eggs. And the age of that oocyte, if you have frozen the eggs, they're around 25 years of age. And when you want a pregnancy around 35 years, the oocytes, the eggs are still younger, of 25 years of age, when compared to 35 at what age you are planning for a pregnancy. A word about the fertility awareness knowledge among the Indian women attending the infertility clinics. A cross-sectional study was done, and most women were aged between 20 to 30 years, indicating that the concerns about the fertility and the need of evaluation. More than half, around 63% of the women were from the middle socioeconomic data, knowledge about the fertility and the reproduction was low. 85% were not aware of the ovulatory periods, the menstrual cycle, and only 8% considered age more than 35 years as the most significant risk factor for infertility. And most were unaware of when to seek the treatment for infertility after trying for pregnancy. Less than half of the women understood the need of assisted fertility treatment and donor oocyte in advanced age. Another study for the fertility awareness and knowledge among the Indian women, it stated that most Indian women across the different socioeconomic strata are unaware of the effective age on fertility, targeted educational interventions, and need to improve knowledge regarding the higher age of fertility, factors affecting fertility potentials and fertility options available for the sub-fertile couples, fertility counseling and information to be provided to young people at every contact with the healthcare profession. We need to come out with the patient education pamphlets, the mass awareness needs to be done for improving the accessibility and fertility treatment for all our patients. I would like to end my talk with a quote. Nothing in life is to be feared. It is only to be understood. Now it is the time to understand more so that we may fear less. So if you are more educated, you will know where to start with the treatment and how to do it.
Thank you, Dr. Rakhi. That was brilliant on the epidemiological factors and the other lifestyle factors. And we definitely have a more detailed discussion on it later after we finish with all the talks. So thank you so much, Dr. Rakhi. Our next speaker is Dr. Nidhi Jha, who will be speaking on the challenges and opportunities for making fertility treatment accessible across India. Well, this is something we are all very, very keenly wanting to hear. How do we have accessibility built up into this IVF procedure? Dr. Nidhi, please.
At the outset, I would like to thank you, Race for Women, Dr. Ratna, and the whole team, volunteers, and the proud speaker. Topic, this one, and topics are for the audience, for the general people. Hope I would be able to do justice with the topic. So opportunities and challenges for making fertility treatment accessible to the fertility treatment, importance of, I'll be covering subjects like fertility treatment, importance of fertility treatment in India, and overview of the presentation. Previous speakers were my very seniors, and they have covered the topic so nicely. I don't think that much is left to me, but I will try to do as fertility treatment is a medical intervention to assist couples unable to conceive naturally. It includes a range of procedures such as IVF, in vitro fertilization, intrauterine insemination, ICSI, ICSI, and fertility medication. Fertility treatments may be recommended for couples who have been trying to conceive for a year without success or have certain medical conditions that affect fertility. So the last sentence covers the definition of infertility, which means you're trying for more than 12 months or more than a year to conceive naturally and you are not able to conceive, then you are supposed to see a doctor. Importance of fertility treatment in India. Fertility treatment is becoming increasingly important in India to deal with marriage, the stress, lifestyle changes, and medical conditions such as PCOS and endometriosis, which Dr. Rakhi ma'am has explained in detail. In fact, it affects around 10 to 15% of couples in India, highlighting for fertility treatments. The demand for fertility treatment is expected to grow in the coming years due to changing societal norms, lifestyle factors. Clinics in India are offering a wide range of treatments, including IVF, IUI, to cater to the growing demand. Success rates of fertility treatments have been steadily increasing, making them a viable option for couples struggling to conceive. So, as Dr. Rita Bakshiman said earlier, that the we are able to give them pregnancy life baby at 40 to 50% of the patients. And when we add donors, surrogates, and the male factor as well, it can go as high as 60 to 70%. Presentation focuses on exploring opportunities and challenges of making fertility treatment accessible in India. Challenges faced by couples seeking fertility treatment in India will be addressed, including financial constraints, social stigma, and lack of awareness, most of which is covered by the previous speaker. Opportunities for making fertility treatment more accessible in India will be explored. The current status of fertility treatment in India will be discussed. The regulatory landscape of fertility treatments will be examined. The future of fertility treatment will be discussed. Contribution. 52.5% of countries' fertility is contributed by age group 15 to 24 years. That is the data. 15 to 24 years. So here all of us IVF specialists sitting here, most of us get the patients who are more towards 30 or more than 50 years of age. So this is the age group which is giving us, this is the age group which is giving us the highest population in India, and we have surpassed the population as well. So we are not dealing with these age group patients. 46% women. So total fertility rate, births for women is 2.13, and in 2022 it was 2.159. And as ma'am said earlier, that we have reached the trend, reached the goal of 2 by 2. This is a single slide depicting that 55% of country's population and living 24 states, union territories have already achieved replacement level. And as discussed by man, that Bihar and UP are much above the fertility level of the other states. Male or female factors in fertility may be a result of one or more male or female factors, as discussed, around 30 to 40% by each, and remaining 20% is contributed by when both the factors are there. So stigma and everything is related, is always talked around females, not by us doctors, but the general population. But we are not able to accept that males also can contribute to the infertility. Wanted an actual fertility rate. Rural India is doing much better than urban India, and it is 2.4 versus urban 1.8. Current status. Fertility treatment in India has improved significantly in recent years. There is a range of treatment options and services available across the country. Access to treatments can be limited for many people. The high cost of treatment is a significant barrier to accessing fertility treatments in India. High cost, as said by the previous speaker, that it is ranging anything above 1 lakh, and even in government sectors, it's not zero, it's ranging more than 60 to 65,000. Lack of insurance coverage is another factor for limiting access. Availability of fertility fertility treatments is limited in certain regions of India, which are underprivileged India, the rural India, the tier two cities and village. Estimates suggest that around 20% of couples struggle with fertility issues, higher in urban area, and the factors as discussed same is pollution, stress, and lifestyle changes contribute to the increase in fertility rates in urban areas. Same again. What are the factors? Delayed marriage. It has been mentioned earlier that females are getting married late, and even not only age of marriage, age of first conception also is increasing because they are when they are getting married, they want to know each other. It takes some time to understand each other. Uh, the separation, the divorces in marriage is increasing, and that's how demography is changing to thinking of conception at a later age. STD infections because of rampant, because barrier contraception and condoms are not used as it should be. The STD rates are increasing. Cultural factors, medical condition, which is very, very important. These metabolic disorders like hypertension, obesity, diabetes mellitus, everything is increasing, and it has been seen in very younger age. Earlier, it used to be in 50s or 60s. We are seeing more and more patients in younger age group with metabolic syndromes, and obesity, PCOS has become a very big area. Lifestyle changes, as mentioned earlier. The challenges faced by couples, lack of awareness, the very most important. Many people in India are unaware of the causes and treatment of infertility. This is very, very important as the acceptance for male infertility is still very less in India. That is making the problem much and much severe. Accessibility to the awareness is the very we and we say that it has been said that infertility is not a disease, it's a desire. So the desire is there, but how to reach that desire is very, very difficult, and still awareness is required. Cost, as we mentioned, fertility treatments can be expensive, and many people in India cannot afford them. Accessibility, when we are sitting in Delhi or any metropolitan city, accessibility for patients who can afford is much more than in rural area or tier two cities. But even when we are talking about urban area or level one cities, the same thing happens that it is not accessible to all of us. Stigma mentioned earlier. So literally, I'm thinking that nothing is left. Regulatory landscape of fertility treatment in India. Fertility treatment in India is governed by the Indian Council of Medical Research, also known as ICMR, which sets guidelines and regulations for fertility clinics and treatments. ICMR has established a national registry of fertility clinics and banks in India to monitor and regulate fertility clinics and ensure adherence to ethical standards, which was finally put in place in 2021. And that has discussed in detail that what is the positive things, and there are negative things as well associated with it, that level of number of donors have decreased, number of surrogacy we are not able to start yet. We are still waiting for it. So there are many other things which are involved. ERC has come with very good things, but few disadvantages also are there. The Indian government has also established the national guidelines for accreditation, supervision, and regulation of ART clinics in India to provide comprehensive guidelines for the accreditation and regulation. Preconception and prenatal diagnostic technique (PCPNDT) Act is not new to us. It was first given in 1994 and amendment was done in 2021. It regulates the use of preconception and prenatal diagnostic technique and prevents the misuse of these techniques for sex selection, and it has shown the result that sex ratio has highly improved in last few years. In addition, the ART bill has shown many changes. Overall, the regulatory landscape for fertility treatment in India is evolving. The word evolving is very, very important. We have seen the regulations. We have been trying to cope up with it. The patients have been trying to understand the regulation and cope up with it. With increasing efforts to ensure ethical and safe practices, improve accessibility, and provide comprehensive guidelines for fertility clinics and treatment. Government, now we'll talk about government policies to promote fertility treatment. One is PMS&A, which is the Pradhan Mantri Surakshit Matritva Abhiyan. It is a scheme aimed at providing quality antenatal. Everything started as antenatal care because infertility was never in government's mind. We never thought that we have such major scale of infertility in our country. So it was started as antenatal care and including screening for infertility and referral to fertility clinic. The referral is very, very important. Government is coming up with hospitals who provide IVF. There are numbers are increasing, but still we have a long way to go. So we are sitting in Delhi, the capital of India, and we can count on fingers the government facilities where we can have IVF. So yes, government is working on it, but still there is a long road. Rashtriya Swasthya Bima Yojana is a health insurance scheme that covers infertility treatments for families below the poverty line. So government has guidelines, government has regulation, but this is not reaching the people we want. Pradhan Mantri Matru Vandana Yojana (PMMVY) provides financial assistance to pregnant and lactating women, including those undergoing fertility treatments. So all these were started with antenatal and postnatal, and later has come to fertility treatments. National Health Mission provides support for the establishment of fertility clinics and centers, as well as training for fertility specialists. So these things on paper are doing very good, but coming to the reality, we as fertility specialists have not seen much. We are waiting for better days to come. So we are happy here that government at least is recognizing the problem and stepping towards opportunities for making the fertility treatment accessible, technological advancements in fertility treatment. So all of us sitting here can say we are at par or even better than any other developed country as far as fertility treatment is concerned. So we have all the technological advancements we need. Government initiatives to promote fertility treatment. As I said, the previous yojana, whatever yojana were there, are addressing fertility clinics and fertility treatments as well, increasing awareness about fertility treatment among the general population. Here comes the wings for women. And there are several societies, organizations working on awareness. They're establishing awareness. Social media is a very good job. So all of the doctors also are using the social media very frequently and properly. So awareness we are trying to increase, but still in rural area, in underdeveloped areas, we are far from the best. Medical tourism in fertility and infertility treatment. India is a popular destination for medical tourism and fertility treatment, with the industry growing at an annual rate of 20%. So when we are talking about international permutations coming to India, it is growing everywhere. One of the main reasons for India's popularity is the affordability of fertility treatment, with costs up to 70% lower than in developed countries like the USA and UK. We think that we are very expensive, but when we compare from the outside world, we are very good, and we are giving world standard treatment, world class treatment at much lower price. India is also known for its advanced reproductive technologies, which I have already mentioned, our previous speakers have mentioned. Role of private sector in making fertility treatment accessible. Investment in infrastructure. These days, if you talk about what I said, that sitting in the capital of the country, I can count the hospitals, the public portals where infertility treatment is given, the ultimate ones like ART. So investment in infrastructure is done by the private sectors. There are ladies sitting here with me, they have done so much for that. Specialist services, specialist, all our IVF centers, all our fertility centers have equipped doctors. As mentioned, there are dietitians, there are counselors. So everybody said there are andrologists involved, there are embryologists involved, there are urologists involved in all this. So we have very good specialist services, accessibility and what would I say? Accessibility in different terms. Accessing a doctor in India is much easier when you talk about even if I'm talking about rural area, PHC, government hospitals, every level you have doctors. You have reach to the doctors. You can come and visit my clinic or anyone's clinic with appointment, a day or two of appointment or the same day. The area we are sitting in, every 5 to 7 minutes, you can see a doctor and whenever you want. That is not available in the Western world. Innovation and awareness, we are working on innovation. Our technologies are much improved, and awareness, that is why we are creating awareness in all of us are sitting here, and many of us on the Zoom. Future of fertility treatment. The demand for fertility treatment is expected to grow at a compound annual growth rate of 9.69%, which is as high as 10% from 2021 to 2026 in India, according to an international report. One more thing, I'm very curious, and I always see these big universities always talk about us, Indian population, Indian infertility, and everything what is happening in India, which also make us feel sometimes that we are doing something good. So many of the data, I'm writing a chapter for family research. So the maximum data on adolescent contraception and adolescent everything, they are doing much research than us on how to invade the country, how to utilize our population, how to utilize our innovations, how to utilize our innovative minds. So many of the data, when I was considering all this, and I've seen that they are studying us. There are conferences outside India that how influencer marketing is working in India. So these data, this shows that we are always talked about. Conclusion, fertility treatment can be a challenging and emotionally taxing journey for couples struggling to conceive, but with the right support and resources, it can also be a rewarding and life-changing experience. In India, there are several factors that can make accessing fertility treatment difficult for many couples, including high cost, limited availability in rural areas, lack of awareness and education, and cultural stigmas around infertility. However, there are also many promising developments and initiatives underway to improve access to fertility treatment and support for couples in India, including government policies, partnerships with private clinics, and community outreach programs. Government has started as before starting the session, Dr. Bharti was saying that government has recognized that PCOS has become an endemic pandemic, and government is thinking of that. So at least they have started thinking. They have moved from contraception to infertility as well. So that is a welcome standard, but getting it out to a ground level, getting it to everyone is still a far-fetched dream. By working together to address these barriers and create more inclusive and accessible fertility care, we can help countless couples realize their dreams of starting a family and contribute to building a healthier and happier society for all. So I would like to end my presentation with these happy faces of the family and the babies delivered by IVF and babies conceived by IVF. So yes, the journey is long, but we are on the way. Thank you.
Thank you, Dr. Nidhi. That was very nice, and I think definitely I like the fact that accessibility as far as the doctors, at least that is there. So thank you so much, Dr. Nidhi. And now we come to the third talk, which is the role of technology in improving the access to fertility treatment. And we have none other than Ojaswini Kapoor, CEO of Bloom IVF Group, who will be taking us through the technology part of the fertility.
So good evening to everyone. So first, I would like to definitely thank Fair Academy and Dr. Ratna Madam and the team to organize something like this. In fact, this topic, the role of technology in improving access to fertility treatment, the perfect example is this particular event, because when I was told that this is going to be a hybrid, where we will be talking in person with people, and also we will having participants online who would be coming here. So I think this is one of the first good examples of how technology is actually changing our lives. Not just healthcare, but all other fields. But I would particularly be talking about how it has been for the business. So most important thing, if something cannot be accessed, it does not exist for us. So for example, in fact, I think just now Dr. Nidhi's presentations were telling us about some government initiatives, and I was not aware, honestly. I mean, I was also like, I mean, at this position also, I don't know some of them. So what I mean to say is that if something is there and nobody knows about it or nobody can access it, then that is something which does not exist for me. So how do you define access? Firstly, of course, availability. Not just availability, you also need to know that that thing is existing in your city or maybe some area nearby you where you can go and have that treatment done. Sometimes there is availability, but at the same time, they have lack of resources. For example, there are many IVF centers in remote parts of India where we have IVF centers, but sometimes they do not have full-time staff. So now if you don't have full-time staff, sometimes you have to create batches, sometimes you're not able to create enough number of patients there. So eventually that place does not function as an IVF center in real time. Affordability, of course, everyone has talked about it, but now affordability remains a big issue in a country like India. We are still developing, also metro cities. Everyone is able to, update it more or less, but definitely in all the remote parts, this is a very big concern. Lack of awareness. Now, I think all the doctors here would agree with me. Lack of awareness, not just about having the services in your city, but even when you are a infertility patient, for example, we have so many times seen patients who come, they maybe had 3 to 4 years of infertility, they are struggling, they come with all their reports, our doctors, and the doctor will see and they will say, okay, these are the reports of the wife, what about the reports of the husband? Where is the semen analysis? where is the, all the reports of the husband, and the husband would be like, no, I am absolutely fine. I mean, we will never got that done. So in 5 years of the treatment, if you have not got yourself evaluated, it was talking about also the increasing rise of infertility in India. Now, as Dr. Asif ma'am also mentioned in the number, that the infertility is in total rise everywhere due to multiple. Now, what is the only one small silver line in that is also it's very unfortunate, but when your treatment, when there are patients, more patients, there are more IVF centers or more fertility centers who are doing it. Now, since there are more procedures happening, automatically the cost of treatment goes down. So it's a basic economics of scale on the principles that we are working. So that is the only, small silver lining about making it more affordable for patients. So now I would come to how is technology helping. So I would be very, very specific on the points because most of the things are already covered, but I will talk about only technology. What are the things? For example, the first one, most important at the moment is telemedicine and remote consulting. Now, telemedicine has been in India for, I think, more than 25 years. But when we all inside, when I remember, I was in Mumbai and we set up a telemedicine center with that was 2007. The whole, set up a video conferencing and we used to connect patients from Africa and our doctors used to consult them. But when did we actually accept telemedicine was in the unfortunate state of COVID. So when we entered the phase of COVID, when actually patients were not able to reach the doctor physically, that is when patients, doctors, everyone started accepting the fact that okay, remote consultations are possible. They are not a problem. We can function with that. And that is, I think, the biggest boon that technology has seen this day. So what all can we do? We can do telephonic conversations. Earlier there used to be a video conferencing setup needed. Now we have smartphones, WhatsApp, Zoom, web, and so many things are there. It's become so accessible to people to talk to doctors and take the necessary advice. Emails are there. There's so many virtual platforms. In fact, like Care Academy also, I'm sure is helping patients to connect to doctors or maybe have some sort of advice. So all the virtual platforms are actively working on that. And you are anywhere in the world, you can access any places like Africa where services are not available. Even if they are not available, they can consult doctors remotely and get at least the necessary steps done before they finally travel to the treatment. It's not just doctor patient. Now we have extensively seen how technology is also helping doctors. Within doctors also, gynecologists are talking, gynaecologists, adult specialists are talking to gynecologists. So everything is now interconnected. They are training each other. Train the trainer is also very important. They are the gynecologists who have never done fertility and maybe in the past. They are getting so much of information online and interacting with the doctor. So they are also able to help the patient in their treatment plan. Next, what we have seen the advent of mobile apps, online resources, and influencers. Now, these are the three main, people and the three main things that are helping the patients nowadays. For example, the mobile app. The mobile app helps to track the menstrual cycles. They can have it to monitor the ovulation. They even help with personalized treatment because all these apps are not randomly made. They are all by some good healthcare agencies and they have counselors, they have doctors on board who are helping them develop all this. So this helps the patients to remotely do these things. Also, there are so many online resources today available for the patients to read about fertility treatments, for them to understand what may be causing it, what they can do to decrease it, and so on. But of course, they need to be very, very careful on the source because these days, everything is there on the internet. So we have to be very careful of that. And lastly, the role of social media influencers. That is extremely important. Although, unfortunately, I have not seen too much of it happening at the moment. Not too many social media influencers are talking beyond fashion and stuff like that. But I think it is to create awareness and also for the destigmatization of this whole issue. Now, this is a very, very important thing. Online support company. I have met patients who are, who have actually decided to get this treatment done, who have, recovered, maybe, sometimes miscarriages, who have repeated IVF failures, and you just lose hope. Unfortunately, this is the only, stream in which it's not like 100% thing that, okay, the replacement that ho gaya and you're done. So obviously, it's a difficult phase for the couple. So online support communities help them, make them feel safe. Sometimes people are anonymous in online forums because they don't want to reveal their identity to the social stigma. And I think that is something which helps. Like even Dr. Rita ma'am was talking about now support turning the stigma. So online support communities have really helped people at the moment. And also, yeah, one very important thing that they also provide valuable information. Sometimes people don't know it. They don't know whether they're supposed, sometimes people in fact don't know that they're fertility specialists and they can even visit them rather than visiting the local gynecologist. So all this information once is imparted to people and they can benefit from it. Now some of the things which I know about which is bridging these gaps. Firstly, there are ovulation treatments using the, you can get the patients at their home only. Have a, it's like a using pregnancy test kind of a thing. So it's a similar way function and it can tell you the ovulation. It may not be accurate, but for people who are just trying, it helps them to have a mental peace and knowing that, okay, this is the time I'm ovulating and this is the time I should try. And of course, many people conceive through that also. In fact, there are, like we do some during IVF, we have to do blood sampling for certain hormones. Even that at the moment is now starting to be at home through urine, and they are still testing that, but this is also something which is coming up very rapidly. Then, as I have mentioned, in fact, in my speech, that government should do, lots about it, which apparently they are, but maybe because people are not aware, so that's why they're not availing it. But government has to include fertility treatment as their primary care in grassroots levels and at more affordable cost because 65, 70,000 is something which even, even private players at the moment are doing. So we have to make it more affordable for people who cannot, afford it at this cost. Then fertility insurance by new age health companies, we have seen that there are many companies now who are coming up with fertility insurance also. They are covering IVF. And there are many corporates now, they are now covering like Meta, all these companies are now covering fertility treatment as well as they are promoting the oocyte freezing for women conceived socially. Then we have online fertility loan solutions. So what I mean by online fertility loan solutions is that having the access to get those loans easily. Of course, it is being backed by banks but what I mean to say is that technology is helping them to ease out the cost. They just have to put it in the form. They don't have to go through a lot of paperwork, and that helps them in being able to take those loans and get the treatment done for people who want to go for EMI. Then electronic messaging systems are there, which are for proper tracking of phones, eggs, embryos. This is an important thing that technology, that the technology IVF centers are using currently, and this helps in decreasing costs now by because automating certain things. So of course, your cost of the resources for that can decrease. Then there is artificial intelligence. This is very very important part of technology. Now, in artificial intelligence, embryos, insights, and sperm, all three of them, in fact, Dr. Rishikesh and Dr. Nanita Pally, who are the medical directors of our and founders, they were one of the first to start with artificial intelligence. And this has helped a lot because when you are able to analyze the data which is present with you and with, of course, other sensors, these artificial intelligence companies have actually helped in identifying the patterns and setting the outcomes. So it's in fact it is also able to check the qualities of the embryos and just help us in not going through the whole process of PGT sometimes also. So of course it is not 100%, but when people cannot afford a service like PGT, then they can always go for the options of artificial intelligence where we can helping them in take and helping doctors to take more informed decisions about the patient care. the diagnosis is better, treatment plans can be personalized, and also these days there are also algorithms using AI which is telling the doctors that how the egg retrieval and selection and implantation of embryos, the timing can be perfect, as much as perfect as possible to give maximum results. So, and how does artificial intelligence help us in reducing the cost? It is by streamlining the processes. It is by minimizing the errors. So when you have less resources but better outcomes, and of course the cost is accordingly. So this is more or less what I wanted to say, that all the trends and all have been discussed. So as infertility is one of the most taboo subjects. So I think it stands to gain the most from technology because it is helping in every way to help the couples in, destigmatize the whole thing and come out with it and get the treatment that they need.
Thank you so much, Jasmine. That was a very nice walk through the recent innovations that are.
इनको focus करना
Should we take Sukha here? So let's hear a patient, very bright patient who discovered a lot of awareness on her own, and actually, I think became nearly half a doctor, going through books, going through clinics, and how she really discovered the whole thing. So can we have Sukha? Yes. Good evening, Sukha.
Good evening, ma'am. Good evening to all of you.
You're muted, Sukha.
Yeah, I'm sorry. Am I audible?
You're muted.
Am I audible now?
Can you hear us, Sukha?
Am I audible now?
You're unmuted.
Am I still muted?
We can't hear you.
Muted.
Am I audible now?
नहीं उधर तो आ रहा था बोलो
Yeah. Am I audible now, or is it
Can
still a
you hear
problem?
us?
Yes, I can hear you. I can hear all of you. Am I still on mute?
कॉल पे लेके कर सकते हैं क्या?
नहीं कॉल पे कैसे ले कॉल पे
नहीं हो सकता।
आवाज आई थी मीट है अभी रिजॉइन करने के लिए
The other question under the right hand, because till now, every single doctor, whether he everybody was treating fertility. With the law in place now, it will not be every single person. Of course, you can look at fertility from the basics. But when it comes to treatment, they have decided to divide the clinics into level 1 and level 2 clinics. So level 1 are the clinics. So, previously PAT labs could wash cement and then, of course, that's how it used to be. A gynecologist sitting anywhere remote, she will just ask the man to go into any lab, go there, give your sample, and, wash the sample, and then the sample would come, lie in the clinic from morning to evening, and in the evening when the doctor gets free, she will just insert it into the uterus of the wife. But
Am I
not
audible now?
anymore, because now it is not possible to do that. Now the government is, that's why the government is tight on everybody. Now it will be level 1 clinic, they will have to take a registration. They will have to pay 50,000 rupees to the government to get registered. Only then will they be able to do even a process like IUI. And for that, they have to have a setup.
Hello.
They have to wash the sample
Hello.
registry, because if you don't wash the quality of the sample, it will be.
आवाज ही नहीं आ रहा ये देखिए अभी जो आस्क कर लो हेलो हेलो
All that. So with that, they are now, not yet, maybe basic with getting investigations, yes. But when it comes to treatment, there are levels now. And so level 1 clinic will be able to do the basic. But if they have to do advanced treatment, it has to be referred to a level 2.
Yeah, yeah. Okay.
Hello. Hello. नहीं हो रहा
So soon you
वो
will
वाला
get it on
audible
the
अभी
portal.
hello है.
And the people
इधर आ
will
रहा
be
है,
able to
इधर नहीं जा
access
रहा है।
the portal, find out,
इधर आ
you
रहा है,
know,
उधर
that's
नहीं
why
जा रहा है।
the national portals, when they are, well, they, I mean, it will take a little bit of time, but 6 months.
Hello.
Yeah, I'm able to hear you.
नहीं हो रहा है।
Yes, I think Shuka, we can hear you now.
Yeah, thank you. Yeah. Thank you, ma'am.
Again disappeared.
Um,
Yes, every center should have a counselor in the center. That is a mandatory.
So, you know, for counselor, what they have said is anybody trained in sciences with 6 months to 1 year, they have not really specified. Then they will be able to, with the specific, of course, psychologists can be good counselors, but they haven't really specified only psychologists. Anybody with a science degree with a training can, but no, I don't think I know of any government program which is training the counselors per se for specifically for fertility. There is a big opportunity.
Very
Yes, yes.
In
yes,
fact, the
yes.
ones that we are taking right now are MA in psychology. So that's
Most
what
of
as
the
a
centers
standard,
are
but they
taking
are not trained specific to fertility. So of course, there's
They
a
would
huge-
be trained by the center itself.
But so you know, psychology anyway will be maybe knowing a little bit, but when they have not specified only psychologists, that means we have a big window where we should be training empathetic counselors.
Totally.
Yeah, counts.
Yeah.
Where we should be training empathetic counselors. Yeah.
Yeah.